Medicare open enrollment. It is right now. That's right, it just started. If you are on Medicare, this is the time for you to make changes to your plan, to add, drop coverage. Medicare, of course, it can be complicated for sure, but to make it easier, we have two experts with us today. Catherine Sevier of AARP of North Carolina, Steve Edmonds of Alliance Insurance Services. And here's the thing, you get to ask these experts your question. You can send in your questions now. All you have to do is text that question to 336-379-5775. All the questions are anonymous and you get your question answered in real time. This is your chance to actually get an expert and find out what you need to know instead of thinking that you might know what the answer is. All right, Catherine, let's start with you. Let's talk about the three things that Medicare open enrollment that everybody needs to know.
Well, it's October 15th to December 7th. And it's for current members of Medicare. So people that already have Medicare as their primary health care insurance, and they're wanting to look at it to determine whether or not the plan they have is the plan they want. So they want to compare plans. And they need to know that if they're going to compare a plan, find it lacking, that they may want to change it. Now, what does that mean? It probably means that they're not satisfied either with their provider experience, or they don't feel like the things that their particular plan, if they're in a Medicare Advantage plan, cover the things they need, specifically things like drugs, testing, rehab. So you want to compare and make a good decision about what you're doing.
And I know there are a lot of people who are like, well, I'm fine. I liked my plan last year. I don't really need to look at the plans this year. You would say what?
If your conditions have changed, your health conditions have changed, or your plan has changed, is proposing a change in the future, you may want to reconsider.
Yeah, and you won't really know unless you start looking at your plan and making sure that they're covering the same things that you liked that they were covering, all right? So, Steve, let's talk about this. There is like a big debate, and people always have questions about original Medicare and Advantage plans and supplements and all that kind of jazz. So let's talk about, kind of give us the 101 of those.
Okay, so that is the most common question that we get on a day in, day out basis in my line of work. So I think what you have to understand with the Medicare supplement, that's the type of coverage that's been around for many, many, many years, and it is really good, robust medical coverage. One big positive about a Medicare supplement is the open network, so you can get your care anywhere in the country. I mean, it's no closed network to it, so that's one of the big pluses. A couple of negatives to Medicare supplements, they do go up as your age increase. So you start out paying a lower premium at age 65, and then you have it 10, 15 years and you're 75 or 80, and all of a sudden the price has went up a lot on it. So we get a lot of complaints about that. And then there's no supplemental benefits with a Medicare supplement policy. So there's no hearing, there's no dental, there's no vision coverage on that. So, but it is probably your most robust medical plan if you're just looking at it from the medical plan standpoint. Medicare Advantage, on the other hand, it's very premium friendly. There's tons of good Medicare Advantage plans that are zero premium. So you pay no premium whatsoever for those. It's a long story about how that works, but that is the premium on a lot of them. It's zero. They do include the drug coverage with them, so they're very user friendly. The premiums do not go up in age, so it's the same premium if you're 65 or you're 85. Everybody's paying the same premium. And they do cover stuff like hearing, dental, and vision. You get all these coverages built into the plan. And also you get other perks like over-the-counter drug coverage and stuff like this. So they're a great plan, and they're a great fit for a lot of people. The negatives on the Medicare Advantage would be a lot of times they are closed networks. So you have to be careful there and make sure that your doctors and hospitals that you typically use are covered under a particular plan. And also, if you have a really bad health year where you're in and out of the hospital 3 or 4 times, your copays can really add up under a Medicare Advantage plan. So you have to pick good Medicare Advantage plans with low out-of-pocket maximums. And if you're really careful about how you put this together, you'll end up with a good product there. So, both plans are good.
Okay, so there's the advantages and disadvantages of both of those. So we want you to ask your questions about all of those things and more. Hey, Catherine, just in case people are watching and they're like, hey, I need to enroll in Medicare eventually, I'm 65 this year. They should kind of stay away at this point from open enrollment.
Absolutely. They have a completely different pathway, and they need to enroll 3 months before to 3 months after their 65th birthday or the month of their 65th birthday. So in that 7 months. So if your birthday is in December, you might want to wait until after December 7th to enroll, or you could have already gone ahead and done it, but it is not the same program as the one that we've just been talking about.
Okay, and we are answering questions on both open enrollment and regular, hey, when do I start Medicare and what should I do when I start it and all that kind of jazz. We're taking your questions when we come back right after this break.